Welcome to HerStory. Today I'm so excited to have as one of our guests a woman who I've greatly admired for the longest time and is a huge source of inspiration for me throughout my entire career. So I'm so pleased to have on set today Mrs Chilufya Mwaba-Phiri, who founded the Zambia Health, Education and Communication Trust.
This is her story. This is her story. This is her story. This is her story.
So for people who don't know, what is ZECT?
ZECT is Zambia Health, Education and Communications Trust. It's a non-governmental, not-for-profit organization that I founded in 2001, started operations in 2002, and we have been implementing multifaceted programs, prevention programs of HIV and AIDS.
And why did you get into HIV and AIDS? What was happening at that time?
At that time, I think HIV and AIDS were very, very severe in Zambia. If you remember, the prevalence, the national prevalence had gone up to over 20%. A lot of people were dying. I had been working for Society for Family Health for 6 years in the same area, but I realized that there was need to expand. You know, we needed to have a lot more people in the field doing this work, and we couldn't just all be in one organization. And so I thought, why not break away, but I mean just go and start another organization so that there could be many organizations working, having to deal with the problem.
And what do you think were some of your successes to date?
First and foremost, I think the fact that ZECT is still there.
Yeah.
ZECT is still there, and we've had our ups and downs, like it is with the non-governmental, not-for-profit organizations where you are depending on other people to give you money to be able to implement your programs. But I think over time we have learned how to deal with donors. We've had some experience in terms of how to write good proposals that will go and fetch money, and that's how we are still there. And I think one of the things that we've managed to do is to be able to actually employ more than 130 people at one time. Yeah, so I think that was really something.
Wow. And today, is HIV still relevant for Zambia?
Very much so. As you know now, universally everybody's talking about no HIV infections by 2030. That is a very big objective. It's a big thing that everybody's looking at, which means that Zambia needs to be doing something. We still have quite a number of new infections, especially among young people. If you remember, in fact, you guys were very much involved in developing youth campaigns, communication campaigns for youth. Those days, we don't have anything like that. Yeah. So the youth that are coming up now don't have as much information as you had at the time. So, so we still are having new infections. We've improved in terms of prevention of mother-to-child transmission of HIV, in that there's been a lot of programs, a lot of work done in the area of getting mothers to go for antenatal care as soon as they realize that they are pregnant, because then the testing is done quickly, finding if you are HIV positive, you are put on treatment so that you don't pass the virus to your baby. The only problem that we have with that one is that we still have quite a lot of mothers that are so far away from health facilities. Yeah. That they cannot afford, they can't manage. I mean, a pregnant mother cannot walk 20 kilometers just to go and have an HIV test. So we have those problems still. But for those ones that go, at least there's been great improvement. In fact, even when we look at the MDGs that we had, that is one area in which Zambia has made progress. Yeah, but we still have pockets of people, like young people. That's why now we are calling them key populations or priority populations, where we need to focus. So you have young people, you have men and women in discordant relationships, where one is positive, the other one is negative, because the chances of transmitting the virus to the other person are still quite high. But I think we are making progress.
There's a lot of attitude these days of it's okay if I get infected because there's just a pill that I can take. Yeah. It's, I mean, obviously the difference now with HIV is that in the late 90s, maybe early 2000s, we saw AIDS, we saw HIV. It was in your face.
Yeah.
Very few people could afford the medication, especially the late 90s,
Yeah.
maybe early 90s, late 90s.
Yeah.
Very few people could afford the medication, and it was very obvious when somebody died of AIDS-related illness. But now this mentality of, oh, it's okay, I can just take drugs. What is that saying? I mean, is this the truth?
I think first of all, people need to realize that it's very difficult to take drugs every day for the rest of your life. And we have seen a lot of cases where somebody may even be doing well, and then somewhere along the way they stop complying, and the next thing they are sick again and they die actually. Yeah, most of them do. So it's very difficult to take medication every day, but also we need to be responsible. It's expensive for the government. It's expensive for the donors to be giving us treatment like that when we could be using those resources for other things. Yeah. So we need to be responsible and make sure that we are taking care of ourselves in whichever way we can and reduce the risk of contracting HIV.
Another challenge is those now teenagers who were born positive, now they're 15, 16, they've been on medication their whole lives, but they don't even know they're positive. And many of them now will start to begin sexually active. Are there any plans of dealing with this, or how can a family, deal with this? It's very difficult to tell someone who's 15 that they've been positive their whole lives when they think they've been taking medicine for appetite or something.
Yeah. In fact, sometimes the reaction has been terrible once they discover that they are actually positive.
Do you have any stories?
We've had instances where children have actually committed suicide because they discover that this is what is happening with them, and nobody has bothered to explain. So we have been talking to parents, encouraging them that they should be able to start talking to their children from as early as 6, 5, letting them know why they have to take medication every day. One of the things that we are doing as ZECT, actually, we got a little bit of money, and we've decided that we're going to put that money into this. We're starting small, but the whole point is to start talking to young people who are HIV positive so that they can become more assertive, become more confident, realize that they can contribute too, and that even though they are positive, it doesn't mean that the world has come to an end.
Right.
And they can date, but they need to do that responsibly. Those are the programs we are looking for actually for our young people in this country. That's why we have a lot of new infections taking place amongst them, because as far as they are concerned, they are young and they are okay. There shouldn't be anything wrong with them.
Right.
Yeah. But there is something wrong, and we need to all keep doing that. And families must take the responsibility of informing the children, the adolescents that are HIV positive, that they are HIV positive, and explain. Sometimes it might be hurtful because because of the stigma that is there.
So is the stigma still high?
It's still there, especially among young people. Stigma is there among young people because it's like, why are you taking medication? And they've learned a little bit maybe here and there about HIV and AIDS. And some of them say, the reason why Kathy is taking medication is because she's positive. And that's the beginning of sometimes even self-stigma.
Right.
Yeah, which
I'm surprised that the stigma is still there, because I know that the Zambian syllabus, I think from as young as grade 4, they are teaching children about HIV and AIDS. So, it's surprising that stigma is still there.
I think that is something that is happening much more in private schools.
Really?
It's not happening that much in government schools.
Really?
It is supposed to be there.
Happen more.
It is supposed to be there. But there are a lot of issues there. There are a lot of challenges, because first of all, the very teachers who are supposed to be teaching them don't have information on HIV. So even if it is there as part of the curriculum, where does this teacher start from? And also they have put it there as a by the way, not that it should be a
Really?
subject that you should know. Yeah,
Really?
that's the thing, and that goes with everything else, including issues of reproductive health. Yeah, it's now that they are trying to get. A curriculum has been developed on reproductive health, and part of that, we've slotted in HIV, but the teachers don't know. They don't have that information.
Wow.
Yeah, so it's such a challenge too. But
And what about women? Because I know back in the days women were at high risk. Are we still?
women are still at high risk. the population of Zambia, in fact, when you look at the statistics, more women are still infected. And that's the reason why we need to still focus on women. Because as I said earlier, we have the aspect of transmission from mother to baby.
Yeah.
So we need women to do their very best to reduce new transmissions to their babies. But also there is the risk of, the risk factors for women are quite many. Some of them could be economic factors.
Yeah.
There are also a lot of social factors. Yeah.
Because also you can't ask your husband to bring a condom into the bedroom, especially for a typical Zambian man, you know, in the rural area.
Yeah.
You know what's going on.
Yeah.
Maybe he works, you know, in border towns where the prevalence is very high, but you still have to just lay there and know what's happening to
Yeah,
you.
that is correct. You know, those things are happening. And the other thing is that, you know, that's why I was talking about economic, because the women will, most of them are like, if I tell him use a condom, there will be two things. Oh, you are telling me to use a condom, that means you are doing something.
Right.
Okay, one. But on the other hand, even, I mean, we know women who already know that this guy is HIV positive. And they fail to stop they fail to convince their husbands to use condoms. Yeah. Because the woman is afraid and said, you know, if I insist, he's going to tell me to get out of this house. And what do I
nowhere
do?
to go.
Yeah.
What other cultural practices or traditions, you know, prevent women from taking care of themselves or protecting themselves from HIV infection?
You know what, when we talk about cultural stuff and, you know, all those kind of things, sometimes, you know, at this point in time, I begin to ask myself, really, really, what is it? I think it is really up to the mothers in the home.
So
It's us, the mothers in the home. How are you bringing up your girl child? That's what it should be. How am I bringing up my girl child? Because culturally, even if you go to the village, there's not one thing you can point at and say, that is the thing that is stopping. I think what is important is to make sure that even if I am in the village, I bring up my daughter in such a way that she will be much more assertive, much more confident, and therefore able. You cannot protect them beyond a certain point sometimes, but you can make them more assertive and more confident such that they can get the skills to protect themselves.
Well, because they say that a lot. I mean, I've heard that even prostitutes have more power because they can demand it's either a condom or nothing.
Correct.
You know,
Yeah.
so maybe it's this idea of if you go into our relationship from the beginning and say this is how it is with me, take it or leave it. You know, and and that then it's nothing new.
Yeah.
It's nothing weird. You know, along the lines.
And you know the sex worker doesn't mind. She's like that. But for a married woman, like I said, marriage is something that is so treasured in Zambia. And then people are like, okay, next thing is going to tell me to leave. I'm not going to be Mrs. whatever. You know, and then what are people going to say? So they don't really think about themselves. They think about what are the people going to say?
That's really interesting because I think it explains why I've heard that the infection rate of middle-class women,
Yes.
married middle-class women, is so much higher
Yeah.
than for the lower working-class women. So I just found that
Yeah.
really interesting. And it
Yeah, no, I
explains
mean,
why.
the sex workers have, there are so many programs, and even today, you have a lot of programs targeted towards them. They are getting all this information. They are becoming more assertive, and they make decisions where they get protected. Married woman doesn't get that kind of information. No. Everybody is assuming that everything is okay in that home. Yeah.
Also, economically, HIV and AIDS has a really big problem. I mean, it's a huge issue for us economically. Do you want to just explain to us
As a nation.
as a nation? Yeah. I mean, from the 90s, what we've seen happen in the workforce.
No, one of the things that we have actually lost as a country is skill and expertise. We've lost. I mean, here is a doctor who trains for 7 years, and then he works for 2 years, 3 years, and he's gone. How long is it going to take us to train another doctor?
Right.
You know, so we've lost a lot of expertise. We've lost a lot of people that would have really pushed this country. Zambia would have been at a completely different level if it wasn't for HIV.
Right.
And then the other thing is the amount of money that we spend on HIV and AIDS. We may not be spending that much money as a country, as Zambia, in terms of the government itself, but there's so much money that comes from other donors into Zambia, including most of the treatment that people get. It comes from outside Zambia. It is not being provided.
So,
for by
and that's
the
very
Zambian
scary
government.
because if the donors had to pull the plug, we're
Well,
in
we've
big
seen
trouble.
Well, this has been talked about.
Yeah.
again and again. Yeah, again and again, and they keep saying we are going to increase, we are going to increase, and I think those are some of the things that are being talked about when we say by 2030 there shouldn't be new infections. Is to
Right.
make sure, because now, as you know, research has been conducted which proves that if someone is taking their treatment consistently, according to the directions given by the doctors, the viral load goes down, the CD4 count goes up, and the chances of this individual transmitting to the next person are reduced. But that means every person who is HIV positive should be on treatment. Yeah.
Right.
But we can't do that ourselves. Right now, I think we have got something like 650,000 people on treatment out of 1.2 million people who should be on treatment.
Goodness me.
That's funny how.
Yeah.
That's
So,
very scary. So what do we do now?
As citizens of Zambia.
Right. Yeah.
How do we
go
take
forward?
responsibility?
I mean, we can't wait for the donors. We can't. You've explained to us for children who are positive, but how do we start talking to our small children now who are,
It's not
you
just
know,
our small children.
well,
I mean, it's
everywhere.
ourselves,
Yeah.
our individuals.
What do we do
Yeah.
now?
I think first and foremost, you as an individual, you need to speak to yourself and say, what kind of a relationship am I in, for example? Because, of course, we know that majority of us adults, we get infected through sex.
Yeah.
Yeah. So what kind of sexual relationships do I have? So, and you begin to tell yourself that, look, I need to be responsible and get myself out of this. And until you get to that level, then it becomes easier for you to start talking to the next person.
Right.
To encourage them. And also because you have the information, you can begin to talk even to the small ones. They do understand, you can explain to them. And one of the things I've seen, for example, in workplaces, you guys are all ladies, you are all professionals here. You have put HIV and AIDS on the freezer.
I know. Go to our bathrooms in
It's
the
frozen
office.
there. Because as far as you are concerned, it's not an issue anymore.
Yeah.
Yeah. But your people are dying at work. And when they die these days, you look at, anyway, that kind of thing.
She
But-
didn't use the insurance, whatever it was.
Yeah. Yeah, but education is better, as you know. They say prevention is better than cure.
Yeah.
So we need to keep on giving people information so that they know. All this research that has been done and the new information that is coming out, people need to know. They need to know so that they can take better care of themselves. It will be less expensive at household level. It will be less expensive at national level. And Zambia and the donors who assist us financially can utilize those resources
For something
for
else.
other things.
How do we support a friend or family member who's going through this?
I think be open about it. It doesn't matter. For me, it doesn't matter even if somebody gets angry with me. I still go back to them until I convince them and I show them that they need help and that what people really need is to have a companion, somebody they can walk with. And you will not leave them somewhere, you will be with them, and if it means going for testing, you are with them.
Yeah.
If it means taking medication for the first time, you are with them. I think it's important.
Have you been tested?
I feel regularly. I feel like I need to go more than I.
Well, actually, it's what you said about being with them. It's very interesting because I had a cousin who, we thought was positive, and she just wouldn't go, and she was getting worse. And one day I just said to her, "Let's go," and just put her in a corner, and there was nowhere for her to say no to. I mean, I already knew this. I was very young. I knew the situation. There was nothing going on, but we're just sitting there, and she's like, "You're very calm," and I'm like, "Well, I kind of know what's going on." And we basically, we did the test, and unfortunately, she got her results, but the counselor was like, "You knew you weren't positive, didn't you?" I was like, "I knew," and she goes, but she was like, it was so good for me to come with her and do the test, because so many times people just get to the hospital or the clinic and they just keep on walking or something because now they just can't face it by themselves. Yeah.
Well, great. I mean, thanks for sharing that with us. I think it's so important that we understand that they are women like you who are still fighting this battle that we forget about because we don't see it anymore.
Yeah.
It's not as blatant as it was. As you said, there are no health campaigns. It's not there, but the reality is that it still exists. And I think what we as individuals have to do first and foremost is make sure we know our status.
Yes.
I mean, that I think is each person's individual responsibility to know your status
help others who need to know this too. So thank you for sharing.
Welcome.
Great.
This is her